Is autism. Autism, also known as autism spectrum disorder, is a condition that means your brain is wired differently to normal or neurotypical people. It isn't clear what causes autism, although it can affect people in the same family, so it could be passed from parent to child. Though we do not know what autism is caused by, we know that it is not caused by vaccines, it's not linked to diet, not an infection that is contagious, and there is no evidence to say that taking paracetamol during pregnancy causes autism. Autism is something you are born with. Within this documentary, I want to show the differences between autistic men and women, show how much harder it can be for autistic women, and spread awareness. Signs of autism is seen differently through ages. For example, in young children, signs of autism are not responding to the name, avoiding eye contact, not smiling when you smile at them, getting very upset if they do not like a certain taste, smell, or sound, repetitive movements such as flapping their hands, not talking as much as other children, not doing as much pretend play, and repeating the same phrases. Whereas in older children, signs can include not seeming to understand what others are feeling or thinking, unusual speech such as repeating phrases or talking at people, liking a very strict daily routine and getting upset when it changes, getting very upset when asked to do something, finding it hard to make friends or preferring to be on their own, talking very literally, and finding it hard to say how they feel. If there is a difference of autism in men and women, what is it? Well, for starters, whilst most autistic find small talk hard, autistic women tend to be better at hiding it. Women generally force themselves to be polite, and this can be seen through autistic women too. They will regularly force themselves to engage in small talk by performing, despite how exhausting it might be. Furthermore, autistic women are often hypersensitive to sensory outputs, though this may be more subtle than seen in autistic men. Things such as feeling claustrophobic in certain fabrics or needing to avoid crowded places. Additionally, autistic women often feel the need for routine and predictability. However, they can force themselves to change due to the conditioning from the societal expectations that women are allowed to be difficult and should be flexible. They will often adapt at the expense of their own mental health. They will often feel intense internal chaos when things don't go their way. Continuing on, autistic women will often mimic each other's personalities and behaviours. They will do this by copying interests or speech in order to fit in. For example, mirroring other people or adjusting their own voice and expressions to appear approachable or normal. They do it so much that they can lose a part of their identity. To finish, autistic women often chronically people please or fawn over people. They often struggle to say no, fearing that they'll be abandoned or that they won't belong, so they'll just go along with what's expected. As of June 2025, 236,225 people waiting for an autism assessment. This is 53% higher than 2 years from that point. Almost 9 in 10 people, or 89% of people, have been waiting for longer than the 13 weeks recommended by the National Institute for Health and Care Excellence, or NICE for short. The average waiting time for an autism assessment has skyrocketed from 13 weeks to 17 months and is exactly 200 days higher than a year ago. An autism assessment is vital to getting the right help and support. Unfortunately, a lot of people get told that they can't access support without a diagnosis and are left struggling. Without this diagnosis, many people are unable to access support at school, work, or home. This can lead them to struggle and often even develop other mental health issues like anxiety or depression, and in some cases end up in crisis or hospital. People with autism often find it difficult to get diagnosed. They often develop depression as a result. This is due to the loneliness that comes with wanting to fit in or belong with other girls their age. After a while, they internalise the pain and begin to think that there's something wrong with them, and that's why they don't fit in. Women on the spectrum are often misdiagnosed or not diagnosed until later in life because they are so good at masking their autistic traits or meltdowns look similar to other mental health conditions like depression or anxiety. So the underlying autism is missed or passed off as other mental health issues. Often being misdiagnosed solidifies the fact that no one really understands how they feel. tell us the definition of autism from your experience?
Yeah, so I would say that autism is a neurological condition. Sometimes people call it a disorder, and I think that's one part of it that is misunderstood. It's a condition, not a disorder. It can affect people in totally different ways. It's a huge spectrum, and there is differences in gender, there is differences in how it is presented, how it's shown, and it can be understood in how it affects people's lives in different areas.
Yeah.
So one of them might be their social communication sort of skills, another might be their sensory processing. You know, one of the stereotypical ideas of autism is somebody wearing ear defenders, but not everybody that's autistic will have a sensory issue with noise.
Do you tell us the difference of autism between girls and boys?
The difference, I think, is a lot to do with how it presents itself. In boys, there's a lot more being out there in the public for people to see through movies or programmes about the impact on boys, and not really very much at all about girls. I think with girls, they are often maybe misdiagnosed or misunderstood, and diagnoses sometimes get missed, to be fair, in girls.
Is autism harder to diagnose in girls, and why?
Definitely, I think it is. I think the why is a hard one, but within the healthcare, I think it's understood as girls being able to mask. So always feeling like they need to fit in, and they can do this thing where they mirror other people around them.
What's the most common problem autistic women or girls face in your experience?
I would say misdiagnosis and being misunderstood.
Yeah.